A fix for overactive bladder or urinary incontinence. Welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Today, I want to share with you a bladder diary, which is a great little tool to help you keep track of your everyday habits and what might be going on with your bladder, to give you some insight and some baseline information so you can make some changes. Typically, some small changes in your daily habits can make a big difference in your bladder health. Okay, so I'm going to show you what a bladder diary looks like. And what I want to say is, first, what I tell my patients when I work with them is it's best to get some data so that we can look at the trends of what might be going on in your life day to day, so that we can actually make some changes and some suggestions based on actual data. So I recommend, if you're going to keep a bladder diary, to keep it consecutive days for 3 to 5 days. That way you have some information on what's going on day to day, instead of doing it like keeping a bladder diary, say on a Monday, and then you don't do it again until Wednesday or Thursday. There's really not as much benefit in doing it that way. So I want to show you, this is an example of a bladder diary. I have this from the Pelvic Guru, and I do have permission to use this bladder diary, but this is what it looks like. And basically what it is just a chart that you can fill in, and you want to take the information based on like when you're going to the bathroom, if you are having leaking, if you're having that sudden urge to go to the bathroom and you have what we call urge incontinence. And then also you want to keep track of when you have bowel movements, because your bowel health can impact your bladder health. So before I go over the ins and outs of the bladder diary, I just want to talk a little bit about overactive bladder versus urinary incontinence. So overactive bladder would be basically you feel like you're going almost constantly. I have patients that tell me, I have a little sip of water and I feel like I have to go to the bathroom right away. They feel like they don't have the capacity to hold urine, and that they go pretty often. They go constantly or very frequently throughout the day. In urinary incontinence would be more like having leaks, okay, where you can't get to the bathroom in time. And there's two different types of urinary incontinence. One is stress incontinence, and that's where you have little leaks or big leaks after, say, a cough or sneeze, or you're jumping or you're laughing, something like that, where you kind of have this sudden increase in pressure, and then your bladder just can't handle that. And there's a second kind of urinary incontinence called urge incontinence. And that's going to be where you feel like you have the urge to go to the bathroom and it's sudden and you don't have any control. Like you have to get to the bathroom right then and right there. And even sometimes while you're walking to the restroom, you have a small or a large leak. So with this bladder diary, you're going to want to keep track of the different types of incontinence or urgency that you're feeling. Okay, I'm going to go over now how to fill out a bladder diary. And I'm using this example, like I said, from Pelvic Guru. So basically with this, you're going to start on whatever day you're going to begin, and you want to keep track of the very first time that you urinate during the day. If it happens to be in the middle of the night, there are spots here that you can fill that out. So here you have the time of day, and then over here would be your bathroom trips. So you would check mark if you have that sudden urge to have to go. You would check mark urge. If you have a bowel movement, you would also check mark that as well. But then here in this column is basically how long is your urine stream. So we want ideally to have a urine stream of about 7 to 8 seconds or longer, so that we know that your bladder is filling up adequately. So if you're going and you're only going a couple seconds, for instance, so you're just counting 1,000, 2, 1,000, but you're keeping track of how long you're going to the bathroom, basically. And then again, whether you have urge here or if you have any incontinence, so meaning any leaking. And here you would indicate if you did, if it was a small leak, a medium leak, or a large leak. So a small leak would be like dribbling, a little bit of wetness. A medium would be like soaking into your underwear, and then a large leak would be like soaking into your clothing where you would have to change your clothing. Okay. And if you're using a pad to collect urine, then you have to use your best estimate on that. I would say a large would be having to change the pad. A medium would be like, okay, I can probably wear this a little longer and wait. And a small would be more like a dribbling. Okay. In this column here, you would also keep track of your bowel movements. Why do we care about bowel movements when it comes to bladder health? Let's take a moment to talk about that, and then I'll come back here and explain more of how you keep track of what type of bowel movement you have. So let's first tackle the question of why would my bowel movements have anything to do with my bladder? So I'm going to show you here a female pelvic model. So we're looking here from the front, and we have right behind the pubic bones, we have the bladder, and then the uterus here, and then you can see back here is the rectum, okay, the colon. And this is cut here for the purpose of the model, but this continues on up into the digestive tract, into your intestines. So you can see front to back in a female model here that we have the bladder in the front and the colon in the back. So can you imagine if you were having issues with like irritable bowel syndrome, where you were having a lot of inflammation and going quite frequently, or if you were having a lot of constipation, how that could create some fullness into this area and could indirectly be pressing onto the bladder. So that's why we keep track of bowel health when it comes to bladder health. So on this bladder diary, it says bowel movement, whether you had one or not. So you would just check mark if you did have one. And then the type is here. So when we talk about types, it really refers to the Bristol stool chart. So this is an illustration here, again, from Pelvic Guru. I do have permission to use this. But you can see different types of bowel movements based on the appearance. So right here, types 3 and 4, this is what we're aiming for as normal. So this type 4 would be like a ripe banana that easily slides out, okay? The consistency, say, of a ripe banana. It's formed, but it's soft, okay? Type 3 would also be a formed bowel movement. However, it's going to be maybe, you might be more sausage-like or like have cracks in the surface. If we get up into type 1 or 2, that's going to be more on the constipated side. So you can see here on type 2, it's still kind of sausage-like, but it's more lumpy. There might be big lumps, several of them in the stool. Or even type 1 would be more like, I tell people, kind of like rabbit turds, right? They're small, there's a lot of separate little lumps, okay? So this indicates that you're either mildly or severely constipated, and you would want to do something like changing your diet, making sure that you're getting plenty of water intake. There can be other factors that go on into that. Then down here we have types 5, 6, and 7, and these are going to be not quite formed. They're going to be more on the liquidy side. Okay, so we can see here that this one is suggesting maybe lacking some fiber, this type 5, where we have more of these blobs, okay? Then type 6 and type 7, where they're more liquidy, they were not forming, okay? So again, looking at diet, maybe working with a nutritionist or a dietitian in that regard, and helping with the consistency and the form of the bowel movement can be really, really helpful in relation to your bladder health. So some other things that are on this bladder diary, going back to the leaking, I forgot to mention. So you would indicate whether it's a small, medium, or large leak. And then what are the circumstances around that? So were you coughing, sneezing? Were you walking fast? Were you carrying something? What was the circumstance with that? You would want to indicate that as well so that we have more data to go based on. And again, you're going to indicate what time of day it was. In this column over here is your fluid intake, okay? And here you can indicate what it is that you drink. Ideally, we want 75% of your fluid intake during the day to be of plain water. So you would indicate that here. I know a lot of people carry around water bottles, and they maybe over a period of time they drink several ounces of water. So I tell my patients, just do your best here. If you drink a 20-ounce bottle of water between 8 and 10 a.m., just put it in there somewhere. We just want to have that water intake And then also, if you're drinking anything like coffee or tea or soda or carbonated beverages, anything like that, you're going to want to indicate that and how much you drink. So this is a good time to talk about some beverages or even foods can be irritating to the bladder. And so that's why we want to keep track of that on a bladder diary. And this is information that I typically go over with my patients as well. But it can be drinks like carbonated beverages. Okay, that bubbly can be a little irritating sometimes to the bladder. Caffeine can be irritating, so soda or even coffee or even like black tea, they can be an irritant. And then things like spicy foods and citrus drinks or citrus fruits can have an impact as well. So on this, we're keeping track mainly of the fluid intake and the type of beverages that you're taking in so that we can see, is there a trend? And I also like to tell people, look, even if you find out that that morning coffee that you're drinking that you really love is irritating to your bladder, you still get to decide what you want to do with your body. So if every time I drink coffee, I know I'm going to have, an irritated bladder. I'm probably going to have a little overactive bladder, but it's worth it to me. I want to be able to still have my morning coffee. For some people, they might decide, you know what, it's just not worth it. Or you might decide that information is very valuable, and now when you go out to have coffee with a friend, maybe you're ordering the tea instead of the coffee because you know that you don't want to be worried about your bladder while you are sitting and enjoying time with your friend. So again, you get to decide based on the information how you want to live your life and the things that you want to change and what you're not willing to change, and that's okay. So after you fill out your bladder diary, if you want a little more help to figure out, what changes to make or, how this makes sense and what to do about it, please reach out to us here at the Healing Spot. We're happy to help answer any questions that you have and come up with a personalized plan to help you. You can head to our website, healingspotpt.com, and pick whatever option works for you. You can also just reach out to us if you are like, I would love to have the exact same bladder diary that you use. Then just reach out to my office and we're happy to share. Thanks for watching this Ed Talk. I'll see you on the next one.